I am Dr. Rohan Shah, Consultant Neurosurgeon in Hardikar Deccan Hospital, Pune. Today I will be talking few points on underdiagnosed entity called Normal Pressure Hydrocephalus, NPH for short form. It is also known as Hakim's-Adams syndrome. It was first reported in 1965. To understand NPH, first we need to know what is hydrocephalus. There is a normal water canal system into the brain where CSF is produced, that is cerebrospinal fluid. It is produced into the ventricles, it comes down to the spinal cord and gets absorbed. In normal pressure hydrocephalus, either there is slight increase in the production or there is slightly decrease in the absorption, causing the symptoms. Normally, the normal pressure hydrocephalus is a presentation is at old age, that is above 60 years of age, with slight male preponderance. Normal presenting symptoms are at least 3 to 6 months or more than that. Patient presenting with three classical features of impaired memory, imbalance during walking and urinary disturbances. The most common differential diagnosis which closely mimics normal pressure hydrocephalus is Parkinsonism's disease, Alzheimer's disease and vascular dementia. There are multiple other causes which are not of that importance. Now coming in brief about the symptoms, patient will have difficulty in walking. In sense, they will have decrease in the step height, the distance between the two steps is reduced, there is decrease in the walking speed, the space between the 2 feet is increased and there is swaying at trunk level. The second symptom is memory loss. There is impaired cognitive function in form of increase in the latency of response time, impaired recall, behavioral changes and decrease in the fine motor activity like writing, signature and doing fine activities with the fingers. The third symptom is urinary disturbances, where in initial stages they will have increased frequency of urination, there will be urgency. As soon as there is sensation of passing urine, they have to run to the washroom and there is incontinence of urine. They tend to pass some amount of urine in their undergarments. Now coming to diagnosis, it needs a high index of suspicion for diagnosis of this condition. What we do is at bedside is a lumbar tap test and check for opening CSF pressure. Before doing this, what we do is check for patient's gait, check for time required to cover a certain distance and check for turning speed, which is usually decreased in these cases. Once we put patient in the lateral position, we pass a fine needle into the spinal cord and drain. We first check the opening pressure. If the opening pressure of the CSF is more than 18 mm of mercury, then it is high suspicion of normal pressure hydrocephalus. Second is, once you drain 40 to 50 ml of the fluid from the spinal and redo all this test, there is significant improvement in the walking speed, turning speed and gait. Urinary disturbances also improves in the short time, but memory aspect, it takes long time to improve, but it doesn't improve completely. Another test which we do usually is a CT scan of the brain or an MRI of the brain, where we see slight enlargement of the ventricle along with CSF seepage into the brain parenchyma. A special sequence called CSF flow sequence shows that there is increased CSF flow into the ventricular cavity. And then the treatment for this is a reasonably simple procedure called ventriculoperitoneal shunt, in which we put a small shunt tube into the ventricle cavity of the brain and divert the CSF into the abdomen. We tunnel the tube through subcutaneously below the skin into the abdomen. Once the pressure reduces, these people will have significant improvement in their walking, in their urinary symptoms and some partial improvement into the memory. This has to be screened aggressively so that people above 60 years of age, they lead a normal life, they can do routine daily activities by themselves and they need not be dependent on other people. If you if you experience any symptoms like memory loss, there is increase in urgency, urinary disturbance in form of urgency, or there is gait imbalance, kindly consult your nearby neurologist or neurosurgeon for the same.